Hi, Tom Suspensky here. I'm just going to take my mask off so we can talk a little bit and another session here on what we can do to help you during the COVID crisis. One thing I'm hearing a lot from our people that are out there working at home, they're on the computers all day, they're going on Zoom calls, and a lot of them are starting to have neck problems. A lot of people are coming in, they say, I can't turn my neck to the left or the right. I'm starting to have pain down my arm. I'm even noticing my arms are starting to get weak. And that's because some of the nerves that come out of your neck that go down your arms feed the rotator cuff and some of the muscles that are essential for your arm function. So I'm going to go over a little bit about what we actually do here so there's no trepidation. A lot of people think when they have neck pain they have to go in and get a big major adjustment on their neck. They're worried about whether they might get hurt, or they might have issues with nerve related problems. So I'm just going to show you basically what we do when we have people with a neck problem. Say you come in, I say, okay, are you having trouble with rotation? And you say, yeah, when I'm driving I can't turn to the right. My right arm starts to feel weak a little bit, so I do an examination. I have them turn their head to the right. And say they can only turn it like 50 degrees, but then they go left and they can go all the way around. That's an indication that there's some type of spinal malalignment, or there could be a block in the cervical area, which is your neck area. And some people might even have old bulging discs, or they might have a little arthritis in the neck that's affecting their ability to turn their neck. And they start to have problems when they have to look forward all the time. I have a lot of people that come in and their head is literally like this, and you say turn your head, and they can't even turn their head. So we work a lot on mobilizing, and this is kind of the position. This is a bare minimum spine. So I would go over here and I would do very light, and this is a hole that you put your face into, and I'm going over each vertebrae, and I'm creating a little bit of motion in each joint. And when you start to work on, and I do what they call grade 2 or 3 mobilizations, where you're going through just partial range of motion with the joint, and I'll go down the center, and I'm trying to get the neck to move a little bit in that direction. I might go to the right, where I push. Right now I'm on the left side, so I push on the left side, and I'm getting a little spinal rotation left. So I go right down the spine, and I work on each segment, and I'll go on the other side. And then after I do that, I'll actually have the person flip over, and there's some joints here that are very interesting, because in your spine here, can you see that? You have a vertebrae that kind of projects upward, so I can actually use that, and these are the discs between the vertebrae. So I can actually do light mobilization, where I can actually move the disc off the nerve root that may be causing that pain in the arm, or causing some weakness in the arm, and also allow you to get better mobility. So in that case, I would do traction, where I would hold the head and pull this way, and I can also rotate to the good side first, and just do what they call axial motions to try to push the disc forward. And sometimes I'll go like this, and I'll use some rotation, and a person will feel like a little click occur. And all of a sudden, with that click, the vertebrae relocated itself, and the person then can turn their neck more appropriately to the right or left, whichever way they're having problems in rotating. So that's just to give you a little tip on what we do here with spinal problems, and we don't use high force manipulations on anyone.